few questions we received were interested in how to support people with dementia to live at home. This is an important topic because it is often the preference of people with dementia to stay living at home as long as possible because, for example, it helps them to maintain their social networks and their independence. But as dementia progresses, people living at home can become more at risk of falls, medication misuse, and the burden on unpaid carers, for example, family and friends, can increase, resulting in negative outcomes for them as well. Previous and existing research has explored how to address such challenges by developing and testing telecom options, assistive technologies, and modifications to home, and also by examining the value of support groups, training carers, and upskilling and personalising care from paid or domiciliary care workers. Research focus has also been placed on initiatives aiming to build community and neighbourhood support for people with dementia and carers by enhancing access and inclusion within the community or introducing neighbourhood roles to connect people with support on offer. Research has shown early signs of positive result from such initiatives, but also that they can be affected by various contextual factors, and not all of these options work for everyone. They can often also sometimes be reliant on unstable funding. DPACT, which stands for Dementia Personalised Care Team, was a 5-year study that Tomasina and I were part of. The study developed and evaluated a primary care-based model of care for both people with dementia and unpaid carers. The model involved ongoing care from dementia support workers embedded in primary care who supported people living with dementia and carers on what mattered most to them, providing them with choice and control over what support options were explored. Some of the ways DPACT dementia support workers helped people they supported including providing tailored information on support options, initiating or chasing referrals from other practitioners and professionals or reaching out and making an initial contact with them, providing emotional support to carers and an opportunity for them to voice their need, and exploring alternative options for support when things that they first tried didn't work. Such support led to positive outcomes, including improved financial aid, care packages, carer well-being improved, enhanced care teams for people with dementia and carers, including occupational therapists, physios, and podiatrists. Such outcomes can help people with dementia and carers to maintain independence and a good quality life at home, suggesting that a specific dementia care worker role within primary care can help people with dementia stay at home for as long as they want.
When someone is diagnosed with dementia, it's completely natural to focus on the day-to-day. But one of the most supporting things that we can do is plan ahead. And one of the questions that we did receive was about this. And the question was, what is the research on carers about making future decisions? Things like power of attorney or deprivation of liberty safeguards that some people call DOLS. So let's start with advanced care planning. That means talking early about decisions that need to be made, medical, legal, and personal preferences. Our own research in the DPACT study showed that it should also be a continuing conversation because people's feelings and wishes change over time. Overall, the research shows that people who do take this step to start early are less likely to have unwanted hospital stays, are more likely to receive better support at home, and more often they die in the place that they want to die. For carers, it means less stress, more confidence in the care decisions, and for some, better bereavement outcomes. So one part of advanced care planning is lasting power of attorney, and simply this is a mechanism that lets a trusted person make decisions on behalf of someone when they can no longer make a decision for themselves. This can be a huge support, especially if they've already talked about a person's wishes in advance and early. But research shows it can be emotionally difficult. Carers may feel torn between honouring the autonomy of the person, ensuring safety, And sometimes there is disagreement in families, and that's why early conversations and clear guidance are so important. Someone asked about deprivation of liberty safeguards or DOLs, and these are legal checks that aim to protect people who lack mental capacity. For example, someone may need to be stopped from leaving a care home to keep them safe. DOLS assessors, or deprivation of liberty safeguards assessors, they usually speak to a carer or a family member to understand what is best for the person. There's limited recent research specific to dementia and carers of people with dementia specifically, but we do know that the process can be complex, and having time to think it through and ask questions with the person concerned really, really helps. So, if you're caring for someone with dementia, here are 3 things we can take away from what research there is. Start conversations early and don't wait for a crisis. Keep those conversations going. Put the power of attorney in place while the person can still decide and think through some really difficult questions. If deprivation of liberty safeguards is mentioned, ask questions, really understand what it entails, and make sure the person's wishes are known.